Let's get you more perspective now on COVID vaccinations and vaccine investment. Dr. Scott Ratzan joins us. He is the Executive Director and Business Partner at Convince. He's also Editor-in-Chief at the Journal of Health Communication, International Perspectives. Welcome to the program, Doctor. Always good to have you. Thank you so much.
Yeah, thank you for having me.
Let's get right to it. Where do COVID vaccinations stand globally?
Well, Sean, thank you for asking and discussing this in global business, because this is about getting back to some sort of sensibility around the world where we have vaccination coverage at a level that we can feel confident that we can travel, that we can have business the way that we're used to, and that we can share time with our family and friends and be able to live in an environment that we have some predictability. So that's what we've been doing with business partners to Convince, to work with both large and small companies around the world to try to give some confident strategies that their employees will know exactly what they need to do. And as you mentioned earlier, in some cases they need to be tested, in some cases they need to social distance, in some cases they need to mask. But all in all, what we've been trying to do is promote vaccination as the way out of this pandemic. And the global vaccination is variable. And as we know, all vaccines are not the same as well. So we really have to be careful about how we describe it. And what we've been trying to do here in the United States and with our global partners is try to communicate as effectively to build trust with both business partners and government and all the important participants in society.
You know, Doctor, I'm struck by the word sensibility. I think that's a great term to use. But what have the efforts been to address vaccine inequities between the wealthy and those developing nations?
Well, all along we've been first trying to, one, remind people of the threat of COVID, and we've been through a number of variants, right? We started with Alpha, Beta, we've been through the Greek alphabet, we're now, of course, at Omicron, and the Omicron subvariants seem to be, yes, more contagious, but frankly, fortunately, they also don't seem to have the kind of hospitalizations and mortality and deaths that we had earlier. So what we've been trying to do is continue to communicate that this is a real threat, to get as many people vaccinated that are at the adult level and get boosted when appropriate. But now I think what we need to do is focus on children, because we have low coverage around children around the world. We've also seen drop off on childhood vaccination, which is a real equity issue. We've made great strides over the years with measles, mumps, rubella, hepatitis, and others. And yet we're now potentially slipping back from a public health perspective.
Just to follow up a bit on the last question, though, what are wealthy nations doing to make sure that the vaccinations are getting to the poor nations, especially the continent of Africa?
Well, sure. Well, since the beginning, as we know, there was sharing of the sequence. We've had a number of vaccines, the mRNA vaccines that Moderna, BioNTech, and Pfizer have helped put together. There is some sharing via this COVAX facility and others. There's other vaccines, the adenovirus vaccines, whether it's the Oxford AstraZeneca, the Johnson & Johnson. There's some new vaccines with GSK and Sanofi. There's been discussion on Sinovac and Sputnik and all these around the world. But all vaccines are not equal. So I think what we need to do is do the best we can to get the vaccines that are already manufactured into country. And then the piece that we're often missing is getting it to the last mile, but also having the demand that people want this vaccine to protect them, one, themselves and their families, and then two, their children, who might be the most vulnerable for the next variant that might be out there.
It's interesting because on Monday I made my appointment. I get my second booster tomorrow. But I'm curious how misinformation has been playing into the mission to get people vaccinated. What's the best way to address that?
Well, Sean, I think that's probably the most important and unfortunate point that we've seen from this pandemic. In fact, it's even called an infodemic, where we have misinformation and disinformation, and some that is sponsored by an organized group, and others just people not getting the right facts. So I think from the beginning, we've been trying to build trust amongst the best organizations. In some cases, it's the government. In some cases, it's business. But the one group that consistently is at the top, and we did a global survey we published in 2020 and now in 2021 of 23 countries, including China, including, I think we had 2/3 of the world's population. And we found consistently that healthcare professionals are amongst the top trustworthy source. So we've been working with groups around the world, whether it's the American Council of Preventive Medicine, they have vaccine confident ambassadors. There's a whole variety of groups that I've been a part of and others to try to get this out there and counter this misinformation that oftentimes is a small fringe group, but with social media, they have the ability to translate and transmit effectively to many, many large audiences.
Thank you very much. I just read today that a bunch of parties are going to be happening in Washington, D.C. over the next month. This isn't going away. Well, I'm sure we'll talk to you again. Dr. Scott C. Ratzan, the Executive Director and Business Partner to Convince, and Editor-in-Chief of the Journal of Health Communication. Thanks very much.
Thank you very much.